We are live now.
Yes, good evening, and first of all, sincere apology for the technical delay. And we are here for a very interesting session, Brain Fitness with Aging. And this is the 13th episode of Story to Tell. Now, first of all, a few disclaimer that this information which we are going to provide in this webinar is only for the educational purpose. So don't consider this as a medical advice. It is not intended to substitute a professional medical advice. The viewers should consult their doctors to determine the applicability of the information. The speaker, that's Dr. Pranav Joshi, Story to Tell, and OrthoTV disclaim responsibility for any adverse effect that may result from the use of or application of the information. So with that disclaimer, let's come to the topic, and that is, why is this topic important for us? This is a wonderful structure, and because of this structure, the human being is able to control the animal kingdom. This 1200 gram structure is a very important structure, and that controls the higher function of our brain. If you look at the brain function starting from the birth till the elderly person, usually the brain function improves till the age of 40 to 50. And after that, there is a slow decline in the brain function. So basically, we expect from this webinar that we get a tip so that the brain function does not deteriorate and we are able to maintain the brain function. So in other words, we can say that let's have a brain of a 40-year-old gentleman, even when we are 60 plus. I'm sure that we all expect that, but at the same time, we get some symptoms like this, we start getting worried. The one symptoms which I recently came across, I met a person after 4 years, and this was without any expectation. And I have not tried to recollect the name of that person. And when we met, I was trying to recollect his name. And that's the very common symptoms. I'm sure those who are above 50 or those who are above 60, they must have faced this problem. The second, we forget where the things are kept. So we forget our key, we forget our important document where we have kept. So this is another very common problem which we come across. Sometimes we forget the password for our bank, the password for entering the Gmail account. So that is another problem. And sometimes we forget the appointment completely. Example is we have a meeting, we have decided in the morning that I want to attend today's Story to Tell meeting, but because of some or the reason, we forget it completely. And why this topic is important? Because medical science has progressed a lot. And because of that, we are able to control the 4 major diseases. Of the 3, that's atherosclerosis, the coronary problem, the stroke, the cancer, diabetes, fatty liver, we are able to control well. But the 4th one, which is neurodegenerative disorders like Alzheimer, dementia, unfortunately, still medical science does not have a great treatment for that. And because of that, the prevention and slowing down are very important. And that is basically the foundation for this lecture, that we are trying to understand what we can do to prevent it and slow down this deterioration which is likely to occur. A lot of friends, they ask me that, Dhiren, why you shared such humor with us with the photograph of Bill Gates. The reason is, in one interview, Bill Gates mentioned that losing memory is my biggest fear. And so my foundation strongly support the research of Alzheimer's disease. So that is what the feeling of Bill Gates. And if with so much of money, if he has that feeling, we are definitely likely to have the same problem. We are very fortunate to have an expert with us, Dr. Pranav Joshi. He is an eminent neurologist practicing in Ahmedabad, and he's associate professor at SVP Medical College in Ahmedabad. And in addition to that, he's a director of ANSA Clinic, which is a very famous neuro clinic in Ahmedabad. And in addition to that, he has a great interest in neurodegenerative disorders, which ultimately leads to brain weakness or brain loss of fitness. What he's going to do, he's going to carry out important research which is available in the journal, but which is not easy for us to understand. So he's going to make it a very easy to understand, a jargon-free language. And that is what the important thing which he's going to do. If you have any question, particularly those who are not joining the Zoom meeting, but viewing this program as a live streaming, they can ask the question on 97129 25600. I repeat, 97129 25600. And we will be able to take your questions after the lecture is over. So with that, I invite Dr. Pranav Joshi to start sharing his presentation. Over to you, Pranav bhai. You are mute. You need to unmute yourself.
Right. So I hope my slides are visible.
No, not yet.
Now?
No.
Yeah, I'm sharing my screen. Okay, I will try one more time.
Yeah.
Sorry.
Yes, perfect.
Right. Right. You can see the screens, right? Right now.
Yeah, perfect. Please go ahead.
Right. So we'll start the journey. Thank you, Dhiren bhai, and thank you, OrthoTV, for giving me this opportunity to interact, especially on a topic which is very close to me, and I like to discuss with the normal person regarding how to make our brain health for a longer period of time. Let me start with an anecdote. Young lady, Nalini Ben, old lady, Nalini Ben, around 85 years of age. She is coming to me since last 5 to 6 years. Her brain functions have deteriorated to a level now that she is around 2 or 3 years of child. She requires assistance for all activities of her daily living, like feeding, bathing, changing clothes, maintaining hygiene and everything. Her daughter-in-law, who is also around 50-55 years, is taking a great care of her since last 4 or 5 years. When they both come to my OPD and I ask Nalini Ben that who is this lady, the daughter-in-law, who is this lady who is accompanying you? The lady, the Nalini Ben, the patients tell me that I don't know. She looks like a ghost. So losing the brain function is very scary, not only for the patients, but for the relatives also. So we are going to discuss what to do not to lose the brain function or not to lose the brain health at a later stage of our life. So let's begin our journey. Aging and associated degeneration is very common. Our hair, skin, the muscle mass, vision, hearing, everything deteriorates as the age progresses. And so does the brain. The brain of a young child, the brain of a adolescent are pretty normal in shape and size and volume. But as we age, the brain starts atrophying. By the word atrophy, we mean shrinkage of the brain. The brain usually reduces in volume. The neurons, the cells of the brain usually get lost. And with time, with progression of time, as the age advances, more and more brain cells degenerate, they all shrink, and the volume of brain reduces. So today's talk, the first topic, as Dr. Dhiren Bhai has already discussed, that why it is important to discuss regarding brain fitness. The second most important part is, what are the normal functions of the brain? What does the brain do in our day-to-day activity? What are the changes commonly associated with aging? What is the disease process, what we call dementia, right? And how we check about the brain functions as we age, or how we can prevent further deterioration in our functions. So let's start our journey. Right. So this is Woody Allen. He is a Hollywood director. And he has put let me put the question in a very simpler terms. Everyone around 50 and beyond have undergone sugar checking, cholesterol test, or ECG at least once in their life, right? How many of us have just gone to a doctor asking to check regarding brain function? How many body profile tests includes brain function as a part of the package? I think none. So brain function or brain fitness is often a neglected topic. Many of well-knowns, what we call celebrity, have suffered from what we call dementia. Dementia is a broad term, a disease of a neurodegeneration. Accelerated degeneration of the brain is what we call dementia. Ronald Reagan, Margaret Thatcher, and in recent times, the two Hollywood actors which have drawn attention is Robin Williams and Bruce Willis. Western world is more open about discussing it in public. When Robin Williams suffered from a particular type of dementia, he and his wife has made a large campaign creating awareness in public. Even Bruce Willis last year got aphasia, diagnosed as aphasia, a form of dementia, and everyone knows through the news agencies. In India also, we have celebrities who are thought to be demented, but they have never cleared. And like Atal Bihari Vajpayee, he was supposed to have Alzheimer's at later age. Kader Khan, Dilip Kumar, they are supposed to have dementia at a later age, but we do not know because we are still, as an Indian, we are not very open to discuss regarding dementia in public. And that's why it is important today that we should discuss what the brain degeneration can cause. Dementia is very common. It usually starts around 60-65 years of age. And if we take the 60 years as a mark, then around 1% of the whole population are showing the signs of dementia. But as the age progresses, so around 80-85 years, 30% of the population may have dementia, some sort of cognitive impairment. So if you are 80, you and your friends are 80, and there are 3 friends, then you should check either one of them may have mild or moderate cognitive impairment. That is dementia. And that's what we are talking about. The estimated dementia prevalence, particularly in India, is around 7.4% at around 60 years of age. Dementia is a little bit more prevalent in females in the Western world and in Indian data also. Not only that, dementia produces a tremendous burden. In 2010, the estimate was around 35 million people suffering from dementia all across the world. We are somewhere here around 2020, which is around 50 million people living with dementia. And around 2050, 115 million population will have some form of dementia. We need to be prepared for the cognitive impairment or dementia or brain aging. So we are going to talk about the brain health today. What exactly is brain health? How do we define brain health or brain fitness? There are no exact definition, but in the previous decades, the main emphasis was brain should be free of diseases. That was not enough. As the time progresses and as we, as a as a person are more concerned about the brain health. Now the CDC, the American Heart Association, American Stroke Association have them defined as the ability to perform all the mental processes, what we call cognition. All the mental processes are called cognition. So ability to perform all mental processes as per normalcy of their age. But then there is a problem. What is normal? A normal cognitive function for a businessman who is running a countrywide business is totally different from a shopkeeper of the same age. So it is very difficult to define what is normal for the age, what is normal for that ethnicity, what is normal for that education, what is normal for that socio-economic status. So it is very difficult to define. So now we move ahead and we define not illness, we define wellness. So the latest definition is we should able to preserve the optimal brain integrity, mental and cognitive function in the age more than 60 years. And that's what we call brain health. What we have already achieved, we would like to maintain that. It depends. Whatever you have achieved, according to your age, your socio-economic status, according to your profession, according to your social structure, whatever you have achieved till the age of 60, you want to maintain that brain integrity for a longer period of time. So this new definition is not based on brain illness, but on the brain wellness part. And that's why it is very important. What exactly brain of every human being does? We all know that it is a command center, what we call a CPU of computer. The intellect part, what we are going to talk today is about the intellect part. The most common function is interpretation of sense and control of movement. But that is all positive, all present even in the animal kingdom also. What makes us different from the animal is intellect. Intellect is a totality of mental operations that comprises the human thought, the higher cortical function, the higher cognitive process that make up the conscious mind qualities, that what separates human being from the other animals, the cognitive and emotional process, the behavior and social cognition. I would like to put Francis Crick, who achieved a Nobel Prize for the DNA with James Watson around 94. And he described it beautifully in a very simple language, that you, your joys and your sorrows, your sense of optimal identity and free will are all in fact no more than the behavior of a vast assembly of nerve cells and its associated molecules. So whatever we are as a human being, in our mood, in our intellect, in our memory, in our profession, is all because of the what movement is going to occur or is occurring in your brain. So brain is the what we are discussing today is cognition, what makes us human beyond the mechanical and sensory function. Human brain has more than 14 billion neurons. It is only in weight, it is only 2 to 3% of the whole body, but it requires 20% of the human supply of the blood, oxygen and glucose, the energy part. So it's a huge part. The brain requires a lot of things, right? For its structure, which is a very relatively small, but its requirement is large. Why? Because it gives us the functions which are very essential. The function to remember, to understand the conversation, communicate, feel the emotions, plan the action, to concentrate, to think, contemplate, and to interact. I'm not going into the details of the word which are medical, right? Memory, remembrance. Language is to understand and to communicate. Executive means to plan an action, to focus, to concentrate, is complex attention. Social cognition is to feel the emotion, to think, to contemplate, and to interact. Right. So these are the different areas of the brain. Usually the previous ethic theory says that there are the different parts of the brain controls the different functions. And in a very simpler terms, we still agree on that. There are various other exceptions to the rules. Now there is more network that they are all intermingled and all this. But very simpler terms, if we define this, the main and most important part for the memory and language is this greenish area, and it is mainly important for the learning, memory, and language. And in our language, it is called temporal lobe. The blue part, which is called frontal lobe, which is most developed part of our brain in humans, is for the executive function and social cognition. And this is what the animals lack the most. The animals do not have any frontal lobe to plan, to execute, to decide, to attach emotionally, to interact. And this is the frontal lobe which usually differentiates our whole existence of human being from the animals. The third part, which is called parietal lobe, the yellowish part, is called visuospatial function, perceptual function. How we perceive the object in the whole environment or whole space is visuospatial function. And the last and posterior, the back part of the brain, is usually for the vision. The vision is also very important. Let me give you an example what the vision and visuospatial function is, how it differs. Usually in a generalized word, we say that mans are more oriented to the roads, to the places. Wherever they want to go, they have that map in their brain. And that is concerned to the parietal lobe, the visuospatial function. But whatever they remember, they cannot differentiate the 20 shades of pink or red, which a female can easily differentiate, right? So vision is, they can differentiate where what a generalized statement is, females, women have more visual function developed and the men have more parietal function developed. So each one has a different, more prominent function. Someone is more frontally prominent, someone has a more memory as compared to that decision making, someone is more have vision related memories, and someone has more perceptual functions. So every man is different and everyone is, every brain function is different. We are not going into details of each, but the most important and most worrisome problem is the memory loss. So I'm just going through next 4 or 5 minutes and focus on the memory. The memory is the ability of the brain to store and retrieve information. It is very necessary prerequisite for learning. And in memory, there are 4 different parts. The first part, attention, is very important. And when we have this attention problem, the next 3 processes cannot go on. We cannot proceed in the next second or third or fourth step. So attention is must for the memory. Then once we attend to a fact, then it gets registered in our brain. Then the third part comes from the consolidation. Consolidation comes from the repetition. If we register one thing multiple times, that it gets consolidated. If we practice some of the rules and what we have registered, then also it consolidates. And then when we need, the brain retrieves it. So the memory has a 4 stage: attention, registration, consolidation of the memory of the registered facts, and then retrieval on as and when basis. Okay, so there are different types of memory. The immediate or working memory, what we call immediate memory, where the person can hold in conscious awareness without memorizing. So if you are talking to someone and someone is giving you a phone number, 9426340876. So you have pen it down, 94263, as he says. So this is in immediate memory. It doesn't get registered. So this is a frontal lobe function. So it keeps only to that part, immediate part. After 5 minutes, this memory gets wiped off. And you cannot remember that same thing if it is in the immediate or working memory part. The second is short-term, or what we call recent memory or episodic memory. That is the temporal lobe part. That is the temporal lobe's function. That is what we have eaten in, what we have today took in the breakfast, how we came here, how was the yesterday night's match. This all comes in the short term or recent or episodic memory. And the long-term memory, the remote memory. They are long known facts, where I have grown up, where I went to school, who was my first teacher, what number I have got in my SSC or HSC examination, how many marks I have received. That is all long-term or remote memory. That is again in a temporal lobe. Other two types of memory, they are called semantic memory and procedural memory. Semantic memory is about the well-known or completed facts, like something about the Earth, something about solar system, something about weekdays, something about year, something about Narendra Modi, the meaning of word. So this is all semantic process. So that comes in the semantic memory. And the last one is a procedural memory. Procedural memory is what we call motor memory, in-hand memory, that how I ride a bike, how I ride a car. So when I started learning, then it includes the short-term, recent episodic memory, immediate memory, attention. And once I have practiced it for a good number of years, now it has come into my muscle. So I don't need to use my brain. Even if I am riding a bike and suddenly something comes up, my leg just goes on the brake, right? So it doesn't require the brain interaction. So it's a procedural memory. So even if you are like good at cooking, then you are talking and then you suddenly do all the required salt and pepper and this and that up to an exact amount. So that is in the muscles. You don't need a brain to work from that repeated action. Why memory is important? As Dr. Dhiren has discussed, that in dementia, memory impairment, in dementia means it's a neurodegenerative condition we have discussed, right? So in dementia, memory impairment is the most common symptom of presentation. The loss of short-term memory is the commonest in Alzheimer's type of dementia, right? We have seen the Ghazini, right? So in that, Amir Khan has a very short-term memory problem, right? He could not remember beyond 15 minutes. So that was a short-term memory problem, right? So let me put it in a very simpler terms. So this is the office, right? And we can see that this is a filing clerk who is attending to the matter. So this filing clerk here is our attention. This storage cabinet is a recent and episodic memory, right? Whenever our brain, our daily routine requires something, this filing clerk can go here and retrieve whatever information is required. This vault here is remote memory. Remote memory is consolidated memory. Even semantic memory is also consolidated memory. It remains, but whenever we require, then it requires usually a few seconds to retrieve it, and then it is consolidated. It usually stays whatever the time. The procedural memory is like something on the table. Whenever something is required, he doesn't need to get up and fetch it. It is on the hands. It can be given any moment of time whenever it is required. Like while riding a bike, I have given an example, right? Riding a car. If suddenly something comes up, the brake is just goes off, right? So that is immediately or very handy in hand. So if this is a memory room, then attention is this filing clerk. If he is absent, then we cannot do anything. We cannot retry, we cannot register, we cannot put a file in the cabinet, we cannot put something in the vault if the filing clerk is not there. Why I am discussing this again? We'll come to that later. That attention is very much required. Filing clerk is very much important in this process. How do I check my memory? The most important is, I have said it again, and I'm saying it again, that attention. If you can remember 7 digits in a serial way, then your attention is good. If someone is confused and you want to differentiate whether there is a confusion or there is a memory loss, then you immediately check the attention. You ask the person to say the months of a year in a backward fashion, right from December, November, October, in that manner. If he can complete this and still is confused or still he doesn't respond, then the attention is good, then there is a problem with the memory, either registration, retrieval, or short term or long term. For registration, we usually, if the patient comes with the memory impairment, first we check attention, then we ask for the 3 things: newspaper, orange, and breakfast. And we ask the patient that you remember this, and then we will ask about after 4 to 5 minutes after checking something else. Then the third part is orientation. This orientation usually checks the recent part, recent or episodic part. What day today is, what date today is, what is the month, year, season, which place you have come, which is the floor, which is the city, state, country. And this usually gives a recent or episodic memory part. And after a while, we ask the patient to retrieve the 3 words which we have asked the patient to remember, the newspaper, orange, and breakfast kind of thing, right? Okay, so the most common question when we discuss something about this memory loss and everything, then the most common question is, like Dhiren Bhai said, that I have forgotten a name of my friend who has met me after 4 years. So is this a problem? So I have put the key somewhere and I have forgotten. So is it a problem? So the first you check, when you have put the keys, your attention, your filing clerk was there or not. If you are very anxious, if you have multiple tasks at mind, then your attention, the filing clerk was somewhere else. So you have not put the attention, so it is not registered. It was not put in the file, and that's why you can't retrieve it. It is as simple as that. Second part of the cognition is language, how we understand, how we communicate, how we read, how we write, how we name the objects. So for this comprehension, the simple methods are: first, understanding, comprehension, simple comprehension. We ask a 3-stage command, like write your name on the paper, fold it, and put it on the table. We ask the person or patient to fulfill that. Fluency, we ask the one from the letter that you have to say me words which are starting with N, A, B, F, whatever you like. And category, depends on the patient's interest. If there is a housewife, then we usually ask the names of the fruit or vegetable. If there is an old man who is interested in politics, then we ask the names of prime minister. Or if it is a young fellow, then we ask cricketers or actors. Then we ask for the repetition. Hippopotamus, no ifs and or buts. These are the complicated repetitions we usually ask the patient when they come with a cognitive impairment. We ask for reading comprehension. They have to read and they have to follow it. Writing is also, we ask the patient to write a sentence with the verb and subject. And in naming, there are so many objects that we have. These are the standardized tests. And we ask the patient to name each 12 of these things to name. And after that, we again check the comprehension, which is a complex comprehension. Like there is a penguin. So we do not say that there is a penguin. We ask them that point the object which is found in the Antarctica. You understand? So this is a complex comprehension, that it has to understand what is Antarctica, how the weather is, what is the common thing which is associated with that. So this is complex comprehension. I'm not going into detail. This is the second part, that is language. Third part, the executive function, planning, judgment, decision-making. The simplest test which we usually do is clock drawing. We ask the patient to draw a clock which shows time, say 10 past 11. And then we have found various responses. Some have a poor planning. So they write all the numbers to the one side if they have a cognitive process problems, right? This clock drawing is a very simple test, and it measures multiple functions: complex comprehension, semantic, planning, execution, everything. So this is a very simple and good test to do for the executive function in the earlier stage. The second is a jar theft picture. This is a standardized test from Boston Diagnostic Aphasia Test, and we ask the patient to describe what he is seeing. So it also measures the visuospatial function, decision making, that this lady has this tap on, which is the water is overflowing. This boy is stealing the cookie from the jar and his table is about to fall. So these are the things which we ask for when we check the executive function. The third test, which is simpler, is this is a picture of two squares and two triangles. I think Dr. Dhiren Bhai has put this in our group, that you have to remove only two sticks and you have to make it to the 4 squares, right? So this is also a test for the planning and execution. The other things are decision making. What do you do if there is a fire breakout? What are the proverbs interpretation the patient knows? So these are the simpler tests which we usually do when the patient comes with this kind of problems. Lastly, some tests regarding visuospatial function. So we ask the patient to copy this diagram. We ask the patient to exactly bisect this line. And then we know that how is visuospatial function, how he see the things in the surrounding environment. The third is perceptual abnormality. Ask the patient to count the dot without pointing at them. So if there is an attention problem or if there is a perception problem, they would not do this. And then we ask them to identify this later. If there is a perceptual problem, it is very difficult for them to interpret this later. And lastly, facial recognition. We show some pictures to them and ask them to identify. You can also check yourself how many you can identify, right? So this was all about the brain functions. Now we move on to the next process, which is aging. What happens with the aging brain? The gyri, sulci, the ventricles, these are the part of the brain. So human aging is mainly reflected in the aspect of brain aging and degradation of brain functions. So brain gets smaller in volume and hence the function deteriorates. So there is a neuronal loss, the cells are reduced in size, so the space increases, the ventricles get enlarged, and this is the common aging process in the brain. What it causes? It causes neuronal loss, decreased connections, reduced chemicals, deposition of waste or toxins, what we call plaques, and reduced blood flow. These are the things which happen to the brain. And we will go into the next session that how we can prevent this. What it causes in the functional impairment? It causes slowing in all the movements, in reflexes, and in thinking process also. It causes difficulty in learning and mild memory impairment. And these are the very common with aging brain, which are the very common scenarios which are associated with degeneration of the brain. Now the next question comes, that aging is a natural process. Aging occurs to everyone. And aging brain, everyone has some or more or less problem with the aging brain. So how to differentiate whether this capacity of the brain is because of the normal aging or if it is because of the disease process? So let's see. Okay. So memory loss is common in aging, but it improves with the clue. The aging people, the normal aging people, usually have that thought in the mind, but it doesn't come to the tip, or they can say it, right? While in dementia, while in disease process, they forgot the event completely. They repeat themselves. Misplacing things in aging is very common, but misplacing the things and putting it in unusual places is very uncommon. Simpler examples are keeping the keys on the table and forgetting is very common, is okay. But keeping the keys in unusual places like jewelry box, that is the problem. Forgetting the entire experience or event is a warning sign. And more warning is if the person is making up stories to cover it up. If they simply accept And if you say that we have gone to this restaurant and we have eaten this, and they suddenly remembers everything, then it's a normal aging. But they completely forgot whether they have gone to restaurant or not, then it's a problem. Then it's a disease process. The second part, difficulty in problem solving. Occasional error is okay. Difficulty in following a plan or recipe which you used to follow since years is a problem. A mother who has made the beautiful recipes on her own kitchen and suddenly starts making mistake, then you should be a little bit worried about the aging process. The familiar tasks, difficulty in adjusting TV setting or microwave sometimes happens with everybody, with every aging individual. But lost to familiar location, lost the way to home, lost the way to temple, forgetting rules of the favorite game, that is initial signs of dementia that we have to be worried about. Confusion about day and day. If they are retired, if they are not doing actively, if they are not reading the newspaper, then forgetting about the day and date is okay. But forgetting about the year, forgetting about the season, not knowing the place, that is something worrisome. Mood changes are also very common with the aging. If things are not done as per their schedule, they have usually a bad mood, particularly in the old age. But if the person is confused, depressed, they are not interacting with the relatives, they are not now involved in the family matters, they are not involved in the family financial matters, then it's a problem. So there are subtle differences between aging brain and a demented brain. And we need to understand this. And that's where earlier intervention to prevent further degeneration can come in. So we know that with aging, poor memory or difficulty in learning is very common. But if it is to a significant amount to interfere with ADL, sorry for this medical term, but ADL is activity of daily living, bathing, changing clothes, maintaining hygiene, putting on clothes, feeding, walking around the house. So these are the all ADL, activities of daily living. So if this memory or difficulty in learning or the aging process is incapacitating any of these activities, then we can say that patient has a dementia. Dementia is a symptom, is a constellation of symptoms. It's not a single disease. Dementia is caused by damage to the brain cells or neurons by multiple diseases process. Neurodegenerative dementias are one of the process. If the patient has a vascular problem like a stroke happened to a temporal lobe, then patient may forget the things. And this is also a dementia, but it is because of the stroke. If there is a problem with the sugar, then also patient may develop some problems. So that also causes some form of cognitive impairment. Similarly, all other diseases, metabolic and demyelination and all other diseases can also cause this dementia. So it's not a single disease. But out of all these diseases, the most common is Alzheimer's disease. Alzheimer's constitute around 50 to 60% of all dementia patients. All dementias, 50 to 60% are because of the Alzheimer's disease. We again simplify the concept of dementia. Dementia is now the word has been changed recently in last 2-3 years back, and dementia is like, we don't want to give a name with a taboo. So what usually a neurologist would say that it is suffering from major neurocognitive disorder and not dementia. The criteria is very simple. Impairment in more than one cognitive domain. If there is a memory impairment alone, then we would search for other causes. If there is a memory plus language or memory plus visuospatial or memory plus social cognition, behavioral problems, then it fulfills the criteria for the dementia. And it should be declined from the previous state. The third important thing is it usually should affect the activity of daily living. And it should not be explained by delirium or depression or other disorders. So dementia per se, or major neurocognitive disorder, as we neurologists put it, is the umbrella term referred to a decline in cognitive ability, a change from the previous state. There are certain common tests, screening tests to check. The SAGE questionnaire is freely available and it can be done at home. The rest are done by the medical professional. And MOCA is the second. MOCA and MMSE are the most common two tests which are done by a neurologist to check for the brain function or brain health when you visit. Now coming to our main topic, how I want to improve the brain fitness, the wellness of the brain. Everyone asks for that memory improvement or brain tonic. Let me say in a very simple manner, the key to happy brain over the years is in the healthy and happy lifestyle. There are no brain tonics available. 6 cardinal measures that everyone can apply for the wellness of the brain, and it should be started as early as possible, at least before 40 years of age. First is sleep. Avoid too short or too long sleep. Sleep according to biological clock, according to the day-night schedule, and not according to our schedule. 6 to 8 hours of sleep, non-fragmented preferably, is what we require or what our brain requires. Watch for snoring episode or apneic or sudden stoppage of the breathing kind of episodes during the sleep. So data from 30-year Europe cohort, 30-year study is a big study in any medical field, and almost 8,000 patients have contributed into that. And they say that there is an increased chance of getting dementia, 30% chance increase in the dementia risk if you sleep less than 6 hours a night, right? Why sleep is important? Because sleep fulfills two main functions. It consolidates the memory and it is the glymphatic system. It removes the amyloid. Amyloid is a waste product, toxic products of the brain cells. During the highest part of the sleep, it usually clears of the amyloid and it is getting ready for the next day. So if you don't sleep regularly for minimum 6 to 8 hours, according to the biological clock, then you are prone to develop a dementia. The second most important, I know I am opening a Pandora's box. Everyone has opinion on how to eat and what is the best. But I am today talking about the scientific research, and that is only to the related to the brain health. Various diet programs have been tried and tested. The most useful ones out of all is Mediterranean, and the second is intermittent fasting. I am not going into details of that, but intermittent fasting diet is like abbreviated version of our what we call Jain diet, right? Eating in a particular 4, 6, or 12 hours time and not taking anything, not taking any sugar for the rest of 12 or 16 or 20 hours time. They say that intermittent fasting reduces the apoptosis, the programmed cell death. It reduces the cell death, the neuron death. The second most accepted diet to improve the cognitive function is what we call Mediterranean diet. But if we look closely, this is what looks like a very much like an Indian diet. It's a plant-based food and healthy fats, high proportion of cereals, legumes, olive oil, and fruit. We usually don't eat olive oil, but a coconut oil or a sunflower oil is equivalent to olive oil in the most of the categories. So Mediterranean diet, more number of or high proportion of cereals and legumes and fruits, and less amount of dairy products, meat or fish. So that's what comprises Mediterranean diet. And what they have found is Mediterranean diet has a very good function, has a very good role in keeping the brain functional. We often been asked, what about vitamin B12, vitamin D3? Some said that omega-3 fatty acid or fish cod liver oil is good. Antioxidant, flavonols, turmeric, everything is good. Yes, they are good for the brain, but only if they are deficient. If you are low in vitamin B12 or D3, you should take it. It helps neuron to grow better. Omega-3 fatty acids reduces the vascular factors like cholesterol and inflammation, and you can get it from the fish or vegetarian source. Only vegetarian source that I know is canola plant. The flavonoids, they are antioxidant, they are good. They are easily available in the berries, all type of berries, blueberries and gooseberries and these berries and that berries. And tea, green tea and turmeric. We all know the benefits of turmeric. I'm not going into detail of that. Let me conclude the Pandora's box, the most discussed topic of diet, by putting it very simpler terms. Eating right on the basis of cultural preferences, native cuisine, and local climate is the most important thing. They recommend oats for the fibers. They recommend green tea for the polyphenols. They recommend dark chocolate for the antioxidant. But do you know what? A mango in the summer has everything: fibers, polyphenols, and antioxidants. So if you have this luxury of taking a mango, why to take oats and green tea and dark chocolates at that point of time? It is as simple as that. Lastly, a word about smoking and alcohol. Absolute no for cognitive decline. In 1990, there was a study, Framingham Heart Study, and it suggested that 1 or 2 drink of alcohol, low to moderate amount of alcohol, is beneficial for the heart. But no, it was not. It is not supported by other medical studies. And now the recent study in 2022 says that even a 1 alcoholic drink a day is linked to the reduced brain size. So this is the diet program. And I think I am not going in details furthermore. The third important part is exercise. From randomized control trials, that is comparative 1-to-1 trial, that older adults will typically involve around 3 hours of training or physical activity per week. 3 hours physical activity per week. For months to a year, there is modest improvement in the brain structure as well as function. So regularly, what the standard recommendation for good brain function is 20 to 30 minutes of moderate aerobic exercise at least 5 days a week to keep your brain healthy. It causes various kind of improvement. It increases the blood supply to the brain. It forms new cells. It increases the connection of one cell to the other. And there are certain chemical changes. What kind of exercise? There are 3 different kinds of exercise which they have studied. The most common is a high intensity interval training. 30-minute exercise where you achieve the target heart rate. That is 120% of your heart rate achievement. The zone 2 training is a lower intensity steady state cardiovascular for a longer period of time. Say the preferable heart rate for your age is around 160. Then you only achieve up to 100. You don't go beyond your heart rate of 100, but you keep it for a longer duration of time. The third is resistance training. That is for muscle building. Usually the preferable is short interval, high intensity training that helps with the brain better. The fourth measure is to stay active mentally, like a muscle. Brain is like a muscle. Train your muscle. You do crossword, do puzzles, do Sudoku, keep on reading, keep playing cards. Not too much of passive activity on TV or social media. If someone asks me, what is the single most important advice for good cognitive function in later stages of life? Learning a new skill is the most important. If you can learn something new after the age of 60, do it. That will help to keep your brain healthy for longer period of time. Fifth, this we often miss. Social enrichment in older adults is associated with increased level of chemicals, increased level of connections, and it causes good consolidation. Loneliness and depression are the major risk factor for the dementia. So connect with friends and loved ones. Last but not least, manage your risk factors. If you are diabetic, if you are hypertensive, if you have high cholesterol, if you have heart disease, or if you have depression, take medicines to treat it. The medicines are not to keep you alive, but medicines are to keep you healthy till you live. And that is the most important. Some of the patients are in around 80, they don't want to take medicine. Why? Because I don't want to live longer. But medicines are not to keep you live longer. It is to keep you healthy till you live. So manage your risk factors. take the medicines regularly, what has been prescribed to you. What if I have started developing or showing the signs of memory loss? The simple strategies are reminders, sticky notes, smartphone alarms that do help. Make a fixed schedule. Don't make changes every day. Keep most of the things at the same time on the same schedule, same time. The third is safe environment. Avoid fall. If you can connect with the people, then if you should be around loved ones, then that is the best possible thing. If you have vision or hearing problem, correct it. Those patients who cannot see well, those patients who cannot hear well, the dementia progresses much faster speed. And family support. Family support is again very important in dementia patients. Keep yourself active, social, physically, and cognitively. With this, I end this, and I thank you all for patience listening. If there is a time permission, then we may go for some of the questions.
Yeah, thank you very much, Pranav bhai, for a beautiful explanation about the topic. Now, I request, like, those who have a question, please use a raise hand function and you will be able to ask question. So the first question, which is very relevant, you said that sleep is very important. Now, a lot of patients have a problem of sleep, like they can't induce the sleep, or once the sleep sets in, after 4 or 5 hours, they get up at 3 or 4, and then they cannot go back to the sleep. So in that case, are they better with taking the sleep medicine?
So the problem is getting up early, or what we call early offset, right? There are two kind of main sleep problem. One is late onset, where your thinking is too much and the brain is not stopping and starting the sleep. And the second problem is early offset. You have slept well, but the duration is so short that you get up very early, right? So in that case, you can start reading something which is a passive input to your brain, which usually induces the sleep. And don't start something active. That is very basic principle to get a good sleep. That the input to the brain should be passive and not something which is moving constantly. Nowadays, since last couple of years, we have seen that the screen time is the most important culprit for the sleep-related problems. And the second question, in the second sub-question, is sleep medications. We usually try to avoid the sleep medication because if they need to be taken for a longer period of time, then they cause a dependency of that medication, and that increases the chances of dementia getting worse. And that is a very proven fact. The only one medication, which is Suvorexant, which is also a sleep medication, but that is very safe for old age patients. That is not very addictive, and that doesn't increase the dementia risk. It was not available till last year. Now this year, it is available in India also.
What is the name of the? What is the name?
Suvorexant.
Suvorexant.
Yeah, Suvorexant.
Spelling?
Suvorexant.
SUVARE.
XANT.
XANT. Okay. Right.
Yeah, Dishit, your question, please.
Pranav, thank you very much. Excellent talk. And at the age of 65, it was very relevant for me because I have started forgetting the things a little bit. We know that Narendra Modi has a elephantine memory, as we all know that for years, if he meets you once, he will remember. That is what I have heard about him. So how one develops this?
So very, very nice question. Very nice question. Thank you for asking that. This is what we call cook problem. What happens is if we want to remember things, then we should attach that memory to something which is very emotional, visual, like something like smell, some other brain functions. Let me give you a traditional example of our learning. When we started learning from the nursery book, when there is a A for apple, there is always a picture of apple and then there is a spelling.
Yes.
Spelling of the apple. Yeah. So the visual part is stored in the right side of the temporal lobe, and the verbal part is usually stored in the left side of the temporal lobe, right? Whenever you visit some restaurant and you like some food, and then next time when you remember that, the smell and the taste automatically comes to your mouth. So when you attach the memory with some other function, like its emotional aspect or some visual aspect or something else, then you tend to remember the things very well and for a longer period of time. And I think that is usually what most of the celebrities do. Whenever they like something or they want to remember something, they attach them with that memory with something, that program or where he made, he was doing some excellent work. So if you want to remember the cook's name, it is very difficult. But if you attach it with its function that he is helping in kitchen to make this, then the cooking is very easy to remember. So that's what we call cook problem. So if you attach its function with this or something, then you can remember it better.
So this will also prevent dementia, right?
Yes, definitely.
If you form this habit from the early part of your life.
Yes. It's very nice habit. It's very difficult, but it's a very nice habit.
So
okay, yeah, Dr. Mustafa.
Can you learn at the later age also?
Yes. You can learn it. You can start doing it.
Okay.
Yeah.
Okay.
Yeah, Mustafa, Dr. Mustafa, your question, please.
Yes, Pranav, you were really awesome in what you delivered. Yeah,
Thank
really,
you.
hats off to you. Now, my question was that, there are some people who just read it once and they remember. And there are certain people who need to remember and revise n number of times and they keep on forgetting. And on the other side, there are certain people who claim that they run classes or certain for improving the memory. Can you throw some light on that?
So Dr. Mustafa, a very relevant question, but some of them are gifted and some of them do practice well. I have been to a Jain Muni's program who can remember almost 150 or 160 things in just half an hour's time, right? And I have seen that them perform excellently. I have tried that myself, but I cannot go beyond 15 or 20 items. So yes,
and they also get reverse also.
Yes. They can do it any sequence, any verbal, visual, some senses involvement, and every way. And I don't know how they do it, but with practice, they say that they can achieve that, and even we can achieve that. But the consolidation parts, the consolidation of the memory, we can do it by repetition, practice, and the third thing is attaching to some other part of the brain, other function of the brain. That is the three most common things which we can do.
Anila Ben, your question, please.
Dr. Pranav Bhai, I am Dr. Kirit Shukla. On behalf of Neela, I am asking you.
Yeah.
Thank you very much. Very good show. The question is sometimes what's your opinion about coconut oil dissolving the amyloid plaques?
I think
you said
I can say on the behalf of the Pfizer and Eli Lilly and so many companies that there is nothing, no single agent they have found which can dissolve the amyloid plaques. Till date, they have I think they have reached beyond the millions and billions they have expensed, but they have not found a complete cure for amyloid plaques. There are a couple of medicines now available in America which shows improvement in reduction the amyloid plaques over the years. But that doesn't always turn into the cognitive impairment. You understand? And the cost right now is too much, $20,000 to $50,000 per year.
No, about using our coconut oil as a cooking medium.
Coconut oil has not definitely, it has been tried, it has been tested, but no, it has not been found to be definitely effective. Yes, it has its benefit. It is better out of all the oils. the sunflower and this has better contained. If we turn towards the healthier spectrum of the oils, edible oils, then these are the better oils. But no, there are no roles of removing the amyloid plaques.
Okay, one more
Pranav
question.
Yeah, please.
Do we have a time, Dhiren bhai?
Yeah, we are running late, so like
Okay.
just quick
Okay.
question and then.
Okay. See, nowadays we do many CT scans even in younger patients, no? So
Yeah.
how do you correlate those atrophies, those they are seen but not associated with dementia? Have you studied
think
that part?
For dementia, we usually do not do a CT or MRI, because once the CT or MRI is showing atrophy, then we are well in advance into the disease. Then we can't do much anything about it. So the first stage, if we ask or if we want to evaluate for dementia, I think it should be neurocognitive testing rather than a CT scan or
No.
MRI. That usually
I wanted to ask you in another way, like a normal patient getting his CT or where there are prominence of Sulci-Gyri.
Sorry.
Yeah,
So
yeah.
I misunderstood that. So that is very common. The atrophy, as per the physiological term, starts in the 8th week of intrauterine life. So there has to be some atrophy at different ages, right? And with the better advancement, like 1.5 Tesla, we are moving to 3 Tesla and now 7 Tesla machines. They are going to pick up the small changes, which are all not necessary to contribute to the problems. In most of the patient, young individuals, when we encounter the memory problem, it is more because of the anxiety or multitasking or attention problem, registration problem, rather than the retrieval problems.
Okay, thank you so much.
Pranav, the two last question, very quick. The one question is about is there any like sexual function has any relevance with maintaining the brain fitness?
No, definitely there are various studies regarding this also, but there are no definite recommendations to say for that this kind of or extra or more sexual activity improves or less activity improves. Nothing, no definite significant scientific data so far.
आपने बहुत लोगों का you have taken pleasures out of a lot of people's life. You know?
I am sorry to say. But the fact is fact.
Right. And the last question, which is Mallikarjun has asked about the name of the drug. So what I would suggest is like, please share the name of the drug with me. I will share with Mr. Mallikarjun.
Can I share the screen for a minute? I have written
fine.
it.
Yeah, please do that.
Yeah. So these are the drugs. So memory, donepezil, rivastigmine, and memantine.
No. The name of the drug which you mentioned.
Yeah. The second part. For behavior, SSRIs and suvorexant. This is the medication which help for the sleep part.
Okay.
You see that?
Yeah. Suvorexant. Yeah.
Yes. SUVOREXANT. Right. Okay.
Okay. Thank you very much, Pranav bhai, for a wonderful exposition on the topic. Like, it's really a topic which everyone is interested, because everyone is going to face the age and we all are worried about losing the brain function. So you very aptly gave the tips, like the 6 tips, which are very important for us and easy for us to remember. They are difficult to carry out, but they are easy to remember.
Thank you for giving me the opportunity, Dr. Dhiren bhai.
Yeah, thank you. Thank you once again to everyone.
Good night.
And apology for the delay in starting the session for the technical reason.
Sure. Thank you.
Yeah. Thank you.